Hello viewers, as we are discussing the mechanical injuries, and this is the lecture number 12 on mechanical injuries and 6th lecture on contusion. In this lecture, I will be discussing the complications, which is the last medico-legal aspect, that the complications or the pathophysiological effects of contusions. Normally, contusions, they heal without any complication, but if they are extensive and sometimes they can lead to infections, they can lead to hypovolemic shock and sometimes to fat embolism. So these are the pathophysiological effects or the complications of the contusion, which I'll be discussing in this lecture. So heading towards the lecture, take care. I am Dr. Javed Iqbal Khokar, Professor of Forensic Medicine and Toxicology. As we are discussing the mechanical injuries, and this is lecture number 12, and the last lecture or the 6th lecture on contusion. And in this lecture, we'll be discussing the last topic of the complications or the medico-legal aspects, which is the pathophysiological effects or the complications. So regarding the medico-legal aspect, this is the last topic, that is the pathophysiological effects of the bruises or the contusion, the complications. They are infections, hypovolemic shock, and the fat embolism. So these are the three most common complications of contusions. Regarding infections, as contusion is a closed injury, so chances of infection are rare. They heal without any complication. But if contusion is associated with other injuries, then there are chances of infection, and bacteria can enter the body and then can reach the site of the contusion where they can grow, and it gives an excellent medium for the infection. Sometimes it can cause gangrene even. So the infection can be, if it is by Clostridium welchi or the gas producing organism, it can produce gangrene also. Then regarding the shock, hypovolemic shock is normally not present, but if the volume is massive, that is, it is involving the large surface area of the body, that is, the body volume of involved area is more than 25% of the total body volume, then it is going to produce hypovolemic shock. And how we calculate it? Length of the contused area multiplied by the breadth and the depth. That gives the volume of the total bruised area. And if it is equal to or more 25% of the volume, then it can cause hypovolemic shock. There is less in extravasation because there is loss of extravasation of protein and serum from the blood vessels. And this can cause reduction in the effective volume of the blood, leading to shock. So if that much area, that is the 25% of the area of the volume, is showing the bruised area, then this area, because of the extravasation of the fluids, blood, proteins, and serum in that area, that can lead to shock. Regarding the fat embolism, due to the compression of the fat, small fat droplets may enter into small capillaries and can cause fat embolism. So summary of this lecture is that we have ended up with the medico-legal aspect of the contusion, and this was the last lecture on the contusion, in which we have discussed the complications or the pathophysiological effects of the contusion, and most common are the infections, the hypovolemic shock, and the fat embolism. So this is all about contusion. Thank you very much. Take care. Allah Hafiz. If you like my videos, please subscribe to my channel. And my channel name is Dr. Javed. Thank you very much.